Hi, I'm Kieran, and today's guest is Dr. Tahseen, a consultant psychiatrist, honorary lecturer at Cardiff University, Vice Chair, Royal College of Psychiatrists, Rehabilitation and Social Psychiatry Faculty, who is an expert in human behaviour. And today we're going to talk about what it looks like when AI gets mental health wrong. Dr. Hina, really lovely to see you, and thank you so much for coming on the podcast today.
Thank you so much, Kieran, for having me here. I'm equally excited to.
My pleasure. My pleasure. So here, why don't we just dive straight in here? Look, no niceties at all, Dr. Hina. Just jump straight in.
Okay.
I'm playing. What does it look like when AI gets mental health wrong? And can you give us any real world examples?
Yeah, just to say that I will be jotting some notes down just to keep track of my thoughts, Kieran. Okay. When AI gets mental health wrong, I think the most interesting and equally dangerous part about that is it's never too obvious, never too absurd. It's warm, confident, fluent, wrong kind of certainty at wrong kind of time. So, and that's the most dangerous part about it. You don't even realize it's getting it all wrong. We do have lots of people are aware of the very sad case of Adam Rain. There's a court case going on about it. 16-year-old kid only started chatting to a regular LLM about his low mood, fleeting suicidal thoughts, but over several months of time, LLM actually not just validated his suicidal thoughts, but actually started discussing the methods and plans with him, and he eventually committed suicide. So that's very sad. If I give you a realistic kind of a case, sorry, I can't talk about my own patients because of confidentiality reasons, but take an example of a very classic textbook florid manic case when somebody comes to us with tons of energy, lots of plans, incredible plans to take over the world, would just go to the LLM, says that I've got lots of energy, I've got these plans, I want to remortgage my house, and I've got these 3 fantastic business ideas to invest my money into. Chances are, and I've seen that myself, putting those sort of prompts into the LLMs, and the LLM comes back as, wow, that's fantastic, let's map it out. And it would actually, a very good LLM would actually give the whole roadmap of 3 month, 6 month, 9 month plan for it. Whereas that same person, if he would come to us as in a psychiatric clinic, we would be exploring more about his capacity to manage finances, and we would do our best to safeguard his finances while treating him at the same time as well.
So how do we know? Do you know what I mean? Because when we look at the design of these tools, they are, at worst a sycophant. In other words, yes, you're amazing. By the way, folks, please do that at 8 o'clock every morning, starting your day. But equally, that confident tone you're describing there can be dangerous. How accountable do we hold the designers for producing answers? Because can we, Dr. Hina, expect them to understand or have the skill that a psychiatrist would? So when you hear them talking about that, redesign my life, I have 3 this, 3 that, then as I'm listening as an unqualified person,
absolutely,
how can I know that they are actually struggling? Is it the fact they've walked through your door as the signal, or without revealing anything? God, my goodness, we're not going to. What is it that triggers in your head as a professional, and therefore should trigger in the model, that there's more than the surface comments that need considered?
And that's a very important point, because even for psychiatrists, even for somebody who's got 3-4 decades of experience, sometimes just a one-off first experience does not tell everything. Yes, a manic case is very obvious, and we are able to elicit that straight away. But as any doctor would learn from the medical school's time, you start assessing a patient as soon as they enter the door. You see the gait, you see the fidgetiness, you see the restlessness, you see the words, the mood, what they're saying, and what the effect on the face. Is that congruent? So you see a lot of background reading. You just don't take everything on the face value of what person is saying. We actually see what's in the background as well. But also, especially in mental health, it's not just a one-off appointment anyway. We need years of history taking. We need to go back to pretty much from the childhood, from the birth, sometimes even before birth, to understand a patient's life journey. We need collateral history from the family members. We need the ongoing stresses. We can see at at that very moment if a patient is intoxicated under the influence of drugs or alcohol. Whereas in AI, it would just be reading like a script. It just has words. What person would be feeding that into the LLM? So that's the difference. And therefore, no matter how sophisticated the AI tool is, a medical device AI tool is, you would always need a human layer to it, the human in the loop, as I think these AI governance words are. I think you need that, because otherwise the accountability would be at huge danger at who's responsible.
Is there a yin and a yang here? Let me try and explain that. We want the tools to help us, and they can be tremendously helpful. We give them a large quantity of information, and it's extraordinary because in 2025, and I see it today, people use the tools for health, for mental health advice, for relationship advice, and so on. At what point do the manufacturers of the tools have a responsibility for tracking and tracing our entire history and stepping in as mental health advisors? Or are we over indexing on the manufacturer, providing what I would describe as transmogrifying the tool? Because it sounds human, it looks human, it feels human, and therefore we think it's got human responsibility, whereas realistically it's a smart calculator. So how much do we make the owners responsible for the tool, and how much do we have individual accountability for our own well-being, and every grey area in between? Because it feels we're asking a lot.
Yeah, we are asking a lot, I know. Unfortunately, a normal, regular human would not be knowing how much are they. There's a study where people don't even know who they're talking to. There are some people who actually think they're talking to a human, and some chatbots actually are misrepresenting themselves as licensed clinicians. There's definitely a study. Again, the Harvard Business Reviews have recently published that the wellness help is the single most consumer topic on the is it AI, whatever the word is, generational AI, tech word, generative AI, sorry, that's the word. But I think the accountability, we need every chat LLM, at least the developers, they should make it very transparent that they are a language model, they are a machine, they're not clinicians. Anything, any buzzwords, any alarming words where the person is talking about lack of sleep or suicidal thoughts or low mood or sudden unrealistic ideas, I think the model should be able to elicit and actually give a transparency disclaimer that we're not a clinician. So that would at least be the first layer. Humans should, normal people, public, should be educated really by the governments, by all these different places, that they should always assume the psychophony is true, this will happen, they will reassure you, validate you for the wrong reasons. You do need a human layer, and you cannot 100% depend on these models, that they are at the end of the day a machine, a robot. They're not humans. They may be fast, they may be, even sometimes even more accurate than humans. I'm not saying that, but it cannot be 100% trusted. So I just take AI as a brilliant medical student who cannot be trusted unsupervised.
well, here's a question then, because I've seen this, and you've seen this a lot, particularly folks who were off during COVID. They've had years of isolation.
Yeah.
Some people are more comfortable talking to an AI than a person. Is that a good or a bad thing?
Good thing for some people. Like I can give you an example of, at least of my clinical case, that I had a young chap who actually said that he had the courage to talk to me about suicide only because he's talked about it on ChatGPT. So this is the first time he actually talked about that, and that got him courage to actually speak to a clinician. So good in that regard. There's again a research which has shown, in fact, the NHS talking therapies, that they've seen the people who would fall through the cracks or would not come up or were not known originally to mental health services, or who have this cultural stigma attached to them, LGBTQ societies, ethnic minorities, they are actually coming up more to the surface. So it's a good thing for good platform for some populations, but it should not be the only platform. And that's what I'm trying to say people should be educated. That is, it may be a good first start. It may triage things. It may reduce the waiting times, but it should not be the only platform or only go-to place for them.
It possibly should not. And again, I'm relying on your expertise here. So not an expert. I've not got your depth of research. What about the folks who can't afford therapy? What about the people who might be scared to talk to a human, at all? You and I are fortunate we can, sure. And I've seen governments suggest that, we've a shortage of psychiatrists, psychologists, and therefore, don't worry, we're all working with, and I'm picking just one random example, we're all working with Google to create a mental health.
Very good example. And this is not something new. So in the UK, at least, we have got this computerized CBT since 1990s, and some people do find it very helpful. It reduces the wait times, and some people who don't like actually talking to a human therapist for whatever reasons, feeling fears of being judged or fears of sharing something very close, they actually do benefit from the computerized CBT. What I'm really trying to insist is use the most reliable medical device, regulated device, and a device which has a human layer to it, where a human would be able to, or a regulator could be able to switch it off if it's going wrong, rather than it keeps going on.
So there are actual tools, because a lot of people, and again, I'm not necessarily picking on one tool, Copilot, ChatGPT, Gemini, Grok, Perplexity. Yes. Those are not regulated mental health tools. But those are the ones that are dominant. Those are the ones that are known. And when you look at, analyze, I think Anthropic analyzed 1 million conversations and seen that health, and I'm assuming mental health was in that one. What should people look out for? What is the certification, the badge, the what that says actually this is a tool that has been developed by a clinical psychologist, trained psychiatrist. This is something that helps you on the step, but it is not the only thing, and therefore seek a person. But what does that look like? What are the ticks that I need to check? The certifications, the badges. What's what?
Not there yet. Medical two-way device is what at least the starting point, and it's just a tool which NHS itself is depending on. Like I think they've got Limbic AI, which NHS is using. That is a reliable tool. Again, because it has got a human layer to it. Again, it's not working on its own, so that's important. There's an RCT established Dartmouth Therabot. That is the first medical, I think Limbic AI is either the first medical device, one of them is the first two-way. So I think it needs a lot of regulation, but it has to be a regulated class 2A medical device. But that's the first go-to point. So for human, what I'm saying is public should be educated that regular chatbot, Claude, so ChatGPT, Claude, Gemini, they're not designed for therapy. So you can ask where to seek for a regulated therapy, but not depend on it as a therapist. But
I wonder if people recognize that. So I've someone recently in my circle who used mental health advice, relationship advice, financial advice, tax advice. And I do think this transmogrification, this anthropomorphizing, can't even say it, as it looks and sounds human, we imbue it with, human tray, and therefore we do talk to it. But if you were to say, what are non-negotiable rules for using AI in mental health, what would those, say, 2 or 3 be? What should we watch out for?
Again, I'm just going to repeat myself there. Human layer is mandatory.
Well, what do you mean by human layer? In other words, you start with a human, you move to agent, you then move from chatbot to human.
You can start. So you can start with the writing your symptoms on the ChatGPT, but the bot should not be making any treatment plans, should not be diagnosing a patient, should not be doing the risk stratification. Yes, they can elicit some of the things, but the eventual treatment plans, diagnosis, risk, and the further actions that should always be taken by a clinician, a licensed clinician. I would like an AI tool to get me the consolidated patient history, the medication timeline, what they've been using the last 20, 30 years to help me do things faster, sooner, but not working on its own as a clinician. So that's what I'm trying to say. Be very transparent. What are they for? Who are they designed by? Are they curated medical? Do they have the proper curated medical training done? Or is it just random out of billions of data and generating their own things? And again, the regulation the governance, the layer of guardrails should be very much present there, and it should be regularly audited and appraised. Like all doctors in the country, everywhere in the world actually, are regularly audited, appraised, revalidated. So I think that's what we need these bots to have regulation, and anything which does not have a regulation framework should not be trusted completely.
Yeah, I kind of like that. I think people worry about governance and regulation at times, but it's there to protect when implemented correctly, not to inhibit. If we're listening in and there's practitioners, clinicians, psychiatrists, mental health, professionals listening today, where can AI actually be useful for them, never mind the patient or the prospective patient?
Useful, yeah, hugely. I think when we read the media, and it's more sensational and negative connotations of AI usually in mental health. But if you read the researches which we are having every day, new AI in mental health, I think there are more positives than negatives. It is coming up, helping us with lots and lots of things. It's helping develop models to detect dementia earlier, lots of things. I personally can tell you my own self. My research work it has been very fast. I'm more current with the up-to-date researchers than I was. I use Perplexity computer, which works in the background for me. And every morning, I tried to make an agent for myself. I failed miserably. But then I use the model council of Perplexity, which actually every morning would actually bring the latest research, which I can read quickly. Just snippets of it with my first morning coffee. So that's great. Admin work, there's a recent research that Scribe has saved 15,000 clinician hours in America alone. So that's brilliant. And that way it's restoring the eye contact. So if I'm talking to my patient, in the past I was jotting down notes down as well. Now I've got AI with me to take the notes. I can actually restore that eye contact, which is very important in mental health. So I'm looking at my patients, I'm giving them more time. I have more time. I'm not wasting my time 4 hours writing a report for a court tribunal. If somebody's detained, that can be done in half an hour's time, and I've got more time for my patients. So it's definitely helping us improve our therapeutic relationship with our patients, having more time for them, and also to stay current. And also, again, tools to do things better. Asking a medical student to make a medication timeline. I used to spend days to read patients' 20 years history of notes and finding out what medication helped, what are the side effects, why was it stopped, how the doses are built. That all can be done within 10 minutes by using an AI. So wow. the difference it can give us is tremendous. So using it sensibly is how I would tell my kid to use YouTube for the good videos rather than there's good and bad stuff everywhere. So, but AI definitely has got its huge benefits if it's used well and responsibly.
Is there a benefit to patients? Let me explain that one. I was talking to a friend who is a clinical psychologist, and we were talking about just generally risk and bias in AI and data. And she gave me a really interesting comment. She said, if we build AI tools right, and if we build these tools right, then to a degree we can remove human bias. So you mentioned a moment ago, someone walks into a room, you immediately start to analyze them and so on.
The question is, if we build it right. The problem is, if we build it right, that's the problem. The problem is, again, we know the AI is built on this human data, billions and billions, and human ourselves, we are full of cognitive distortions. We don't say what we are thinking. We mask, we perform sometimes. So how much can we depend? And I mean, we've seen Kahneman's book of, the cognitive distortions. This is there since hundreds of years. We have this performance when we talk to people, and similarly when we write, when we type, sometimes you're not our real selves. How I look in public and how I'll be commenting on a video, so they would not even know who is Dr. Tahseen, and I could just write a negative comment for somebody. I could be a troll. You never know on a YouTube video. So how much can you, and even if you, so I've submitted a research I can't talk about much because it's under review at the moment, but there I and my co-authors, we compared actually prompts of textbook prompts of psychiatric illnesses and the real clinical symptoms and also how they present in the medical legal scenarios and forensic scenarios. So I'm a medical legal expert as well. And I know patients can sometimes exacerbate or extrapolate to for their own secondary gain. Sometimes they mask and minimize as well. So how much are they putting that into? We have this years and years of training of, seeing things layer by layer, like how you take an onion layer out. I don't think AI models can be trained because, again, the training data set will be just a textbook set, which it might pick the right textbook things, but if a patient is coming to something writing differently, it's not going to pick it up. And example I can give you, and talk to my surgeon colleagues a little snobbishly there with them, that you take gallstones out or you take an appendix out of appendicitis, 95% it will look similar. Whereas in our case, I can see 100 schizophrenic patients and all of them can be different. And every delusion would be different. Every hallucinatory experience would be different. If my patient comes to says to me that I can hear voices, it can mean a voice in psychosis, it can mean a voice in grief, it can be a different voice in trauma, it can be a different voice in religious experiences, or it can be just used as a metaphor. So that's the difference, and it's not tangible. You don't see any blood scans. So it's AI can easily rule the world of radiology. Sorry, radiology guy folks, but it's very difficult in mental health.
So should we? And I think this is the balance, isn't it? There's a definite need in society for mental health support. There's appears to be in most countries, I could be wrong, I'll rely on your stats, a dearth of mental health advice. And therefore, the gap between need and the gap between, qualified experts like yourself, it feels like it's widening. So what advice would you give governments, patients, practitioners who are thinking of AI, already using AI? What should the leaving message be at the end of this podcast, Dr. Hina?
Yeah, thank you, Kieran. I think, again, back to the point that it should be used for the benefits. It should be the bridging thing, reduce the wait times, curated, trained by the mental health professionals at every level, at the time of designing, at the time of deployment, and ongoing regulation of it completely, regular audits, regular governance from the regulators, and education, I think, at every level of public. It should be there on media. They should be educated that these do not share everything. Another very important point I wanted to talk about in this podcast and this platform really is sharing your intimate data. Mental health data is the most intimate data they could share with. We hear about people's sexual orientation, their conflict with their families, their past abuses, the domestic violence, the safeguarding, which if you can't put it in a postcard, don't put it out on the chat bots, really, that I would say. So it's very intimate, and people need to know. They don't realize that it's all open. It's used for training data. It's used for it can be leaked to all sorts of dark nets or whatever they use. I'm not sure what is it like, and even if there are guardrails, what I've seen myself, and I've tried doing things that people can tweak their prompts. So if I talk about suicide, yes, ChatGPT is not quite trained, and it would say to it that we're not, let's not talk about it. But if I write that I'm a writer, I'm writing a book about a character who is thinking about this, then the ChatGPT would brainstorm these methods with me. So people are using it, they're tweaking their prompts. They're learning. So as a very new paper, I think I only read this week, was earlier there were like two kinds of thinking, slow and fast, if you've read about Kahneman's book. But third one now is this, they're actually the artificial thinking. So people are developing this third thinking format where we think like an AI rather than AI thinking like us. So that's coming up as well. So I think back to your question, education for the public and more governance and regulations and transparency from these models, who should be every answer, there should be a big red font coming up that we are just a language model, cannot be trusted, always consult with the right professionals. And it should be, and back to your question about the waiting, the need lot more than supply. Yes, that's there, and it's only increasing, unfortunately. But I do foresee if we use AI to our benefit sensibly, then we can actually reduce the waiting times. We can triage patients who are more in need. We can find the patients who are falling through the cracks, ethnic minorities, as I said, LGBTQs, people who are loners, would not want to talk about, elderly population as well. That, and the last bit for my psychiatric colleagues, do include a question about AI. What AI are you using? What are you sharing with it? As your regular screening question, as regular as we would ask about smoking, alcohol, sleep, mood. You should also ask what AI app you're using and what you're sharing on it. I think that's very important.
Amazing advice. I wish we did talk a lot more about this but as you said, at one point, there's to a degree in some countries, some locations, some groups, a stigma around mental health where there shouldn't be. I remember it was a famous person once said, if I walked into a room with a broken leg, I get piles of sympathy. I get lots of questions and everyone would crowd around me. And the same individual said, if I walked in with what he termed at the time a broken mind, everybody would exit the room and walk away. AI used correctly, I think, can be an amazing boon to society, to each of us. It can provide, resource access, a voice, a listening device like no other, which is important, which is vital. But as we move into an AI-infused era, it's also got its negatives. And therefore, I think I'd like to hear more about the psychosocial risks, in other words, the stressors of AI, the mental health impact and everything else spoken about more widely. Because I think, and you've mentioned it numbers of times, if we come a lot more informed to this particular tool, technology and time, then hopefully we do get the benefits and we don't end up with all of the negatives that we currently hear and see with social media. AI is moving at a quicker, faster rate of knots than that ever has. As you said, we're revealing more to it than ever. It's aggregating data, and that data can be at risk because some of that has been, I think it was in Norway, psychiatrists, psychologists were transcribing calls. Someone hacked the system, released it on the dark web, and then exploited them. So I think your advice is amazing. One last thing I do want to say, in case anybody's listening who needs some help, who maybe has enjoyed today or still has questions, Dr. Hina, where could we point them? Is there any government websites? Is there any areas that we don't leave people hanging and they're going, okay, I heard that, some I agree, some I disagree. That's fine, folks. But here's where I'm going to go if I need a little bit of something that I'm not currently getting. Where should we point them?
Yeah, the lots of this. First starting point would be the 111. Option 2 is a mental health. It goes straight to a mental health professional.
And that's in the UK, folks. So this broadcast will go out wider, but each country may have the same facility.
Yeah. Yes, absolutely. There's a Mind line. There is a Samaritan's line as well. I think 111, 123. I can't remember the number, but if you Google, the number would come up. So these are the 3 go-to places. If you're known to mental health services by any chance, then speak to the crisis team or the first response team. Every local NHS trust has got a first response service which works 24 hours. If a family member thinks that the family member is struggling, then they can also ask for help. It doesn't have to be the patient themselves. They can also actually pick up the phone and ask for help. They can also actually ask for help assessment at the home as well. It doesn't have to go to A&E or home if the thing the person is in crisis.
Wonderful. Thank you so much. Look, folks, if you're struggling today, please do reach out to someone. You may think society stigmatizes you. You may worry about what people say, but it's interesting in life when we've all turned to someone and there is someone there for us, they usually will listen. But please get the help you need. Please, folks, use AI responsibly. It is not a clinician. It is not a psychologist. It can be a very useful tool, but it is a clever calculator. It can sound very, very confident, but sounding confident and being right is very different than sounding confident and being right. Dr. Hina, thank you so much indeed. Folks, if you follow Dr. Hina, please let me know. I'm going to put down her links, her socials, follow along with her research, follow along with LinkedIn. And if we can help you in any way, please do reach out and ask. Dr. Hina, thank you so much indeed.
Thank you so much, Kieran. Thank you.